COVID-19 Awareness Video by Caitlin Young. In this video, I'll be talking about the following. What is COVID-19, how the virus is impacting lives, results of this pandemic, needs and wants, ways of prevention, and coping methods. So, what is COVID-19? COVID-19 was originally found in animals like bats, but has now transferred to humans as a respiratory illness. Coronavirus is a family of viruses that differs from the common cold to more serious diseases like SARS, severe acute respiratory syndrome, that happened in 2002, and MERS, Middle East respiratory syndrome, that happened in 2012. The first case of the virus appeared in Wuhan, China, in November of 2019. Since 2020, the new coronavirus disease has been named COVID-19. COVID-19 has symptoms very similar to the common cold, such as a fever, dry cough, and fatigue. Not only that, symptoms such as aches and pains, runny nose, sore throat, difficulty breathing, and diarrhea may occur. It is also considered the most dangerous for people of older age and those already with health conditions. How the virus is impacting lives. Businesses are closing down to prevent the transmission of COVID-19. Therefore, many jobs are being lost and impacted. For example, businesses affected are related to retail, accommodation, recreation, transportation, warehousing, and food services. Students are impacted because schools are closed to prevent the transmission of the virus. This leads to online schooling for almost all schools in Canada. It makes it harder for students to learn as curriculums are altered for their education. The mental health of students are becoming worse because it is difficult to concentrate alone at home and with no face-to-face communication with a teacher. It also makes it difficult for those financially impacted who may not have the internet or technology to perform online education. Social distancing is essential to help prevent the virus from spreading, but can result in mental health issues, which will be talked about later in this video. Seniors are being impacted by this virus, especially because of their old age and possibly medical conditions. Being in the public can put them at risk of infection by this virus. If they are not careful enough, they may get COVID-19. It could result in deaths due to a weak immune system that cannot fight off the virus. Social distancing is a way that seniors can protect themselves from the exposure to the deadly virus. COVID-19 is easily transmittable through person-to-person contact. Droplets from infected people who are sick can be inhaled into mouths or noses of people who are not sick and are nearby. COVID-19 is also thought to be transmitted through infected surfaces by touching one's own face. As days go by, the growth of infected people increases. There are more deaths and more cases throughout the world. As of March 27, 2020, the entire world had just below 600,000 cases of COVID-19, 30,000 deaths, and just over 130,000 have recovered. Canada had just below 5,000 cases, exactly 55 deaths, and exactly 354 have recovered. British Columbia had just below 800 cases, exactly 16 deaths, and exactly 275 have recovered. Several days later, on April 2nd, 2020, numbers have reached over 1 million cases worldwide. Results of this pandemic. Financial. This pandemic may result in financial issues for some families, including housing, utilities, incomes, grocery bills, and other necessities needed to be paid. The Financial Consumer Agency of Canada, FCAC, provides people with educational resources on credit, savings, budgeting, debt management, and more. The new Canada Emergency Response Benefit, CERB, will support a $2,000 taxable amount a month for up to 4 months if unemployed due to the pandemic. if unemployed due to the shortage of work, such as closed or decreased operations, and if qualified for employment insurance benefits, EI can be applied. If sick, quarantined, or self-isolated, EI sickness benefits are available to apply. Fortunately, the worry of a 1-week waiting period will be waived, and proof of a medical certificate to access benefit is not necessary. The Canada Child Benefit CCB has been raised to an extra $300 per child. Educational. Students are no longer allowed to attend school and have to adjust to online learning instead. Health. Those who are of higher risk are older adults aged 65 years and older, people who have pre-existing medical conditions, and people who live in a long-term care facility or nursing home. Population. People are slowly being infected, causing more and more deaths. As a silver lining, with being at home, social distancing, we are increasingly being more caring and kind towards one another. It is bringing families closer, as they are able to spend more time together. Not only are families being closer, but also, neighbors are helping one another out. For example, to buy groceries for those who are sick or are not able to leave the home. However, those who come from abusive homes, children or vulnerable women, have nowhere to go as they are trapped in the same house as the abuser and encounter even more severe abuse or manipulation. Needs and wants. In reality, families need to survive on food. In order for that to happen, they need to go grocery shopping, which is exposed with potential COVID-19 lingering in the public. This provides a high risk for those who partake in grabbing essential needs. Unfortunately, there are people who choose to disobey ways of decreasing the virus, such as social distancing or hand washing. Ways of prevention. COVID-19 can be prevented by avoiding all traveling that is not necessary, including planes and cruise ships, quarantining or self-isolating at home, monitoring potential symptoms for 14 days, reducing contact with others, and wearing masks if necessary. Other ways of having proper hygiene includes frequently washing hands with soap for 20 seconds, using arms when coughing or sneezing, and avoiding touching any part of the face with an unwashed hand. Cleaning surfaces, including disinfecting with proper disinfectants used against COVID-19. Wearing masks can prevent the spread of this virus. The masks plays a role as a barrier to help stop tiny droplets from spreading when a cough or sneeze happens. Social distancing at least 6 feet from people, including friends and family, which minimizes close contact. Being in social distancing also may create some mental health issues. Depression and or loneliness may be a result of this virus because of being socially away from others and not being around all the people we love. Stress and anxiety may also be a result of this virus because of the constant fear of having a chance to get infected by the COVID-19 virus. Coping methods. There are many ways to cope with negative feelings related to our mental health throughout this tough time, which includes participating in activities that are personally enjoyable. Some healthy examples are working out, dancing, singing, baking, painting, gardening, reading, meditating, listening to music, talking to friends, or playing with pets. Those activities make it possible to prevent unhealthy coping strategies. Also, it is not healthy to fight over toilet paper, so please only take what you need. In all seriousness, talking to trusted adults about feelings can be a good help, but also there are organizations like the Kids Help Phone that can help talk through negative feelings. The Kids Help Phone number is 1-800-668-6868. There is always a way to cope with feelings. Please ask for help. Call 1-866-866-0800 if you think you may have the virus. Options will be discussed with you on the phone. We're facing a really tough episode, but what's relieving is that we are all facing it together, bringing each and every one of us closer than ever.